poor treatment adherence in children. Children don't take drugs directly, like we know. Their medications are usually given to them by caregivers. So in a case where the medication tastes so bitter that the child ends up vomiting, or there is spillage as a result of mishandling, or the caregiver is confused on to ask, how do I administer these drugs to this child? Or in areas where patients do not have access to pharmacies, neither do they have access to pharmacy counseling. It could lead to missed or rejected doses. It could lead to poor compliance, which can actually lead to complications that can be avoided and prevent deaths that could have been avoided. So, how do we now come in? What can we do to mitigate these barriers? So, coming up with optimized formulations like dispersible tablets not only help in ensuring ensuring compliance, ensuring improved adherence, but it also ensures that we save lives. So why dispersible tablets? Dispersible tablets are optimized formulations. So you put a tablet in 5 to 10 ml of water, it dissolves and it's pleasantly flavored, and you give it to your child. It is more stable when it comes to the artemether-lumefantrine formulation. The dispersible tablets has been shown to be more stable than the suspension, and it is easier to carry around. It is more affordable, so you are sure that parents or other caregivers in the poor and marginalized community can afford these medications, give their children, and save the lives of their child. It results in better patient outcomes because there is reduced cases of vomiting, and it is absorbed faster. The absorption rate is faster, even though the bioequivalence is similar to that of conventional tablets. So, the combination of the artemether-lumefantrine and paracetamol in children in the treatment of all complicated malaria in children is the WHO guidelines is treating malaria in children. Artemether-lumefantrine is the first line treatment option for uncomplicated malaria. This helps to clear out the parasites. Then the paracetamol helps to manage the symptoms such as fever and headache in the child. And the dosage form is pleasantly flavored, so you know that it will be accepted by the child. So Emzor has 2 products that can be used in the treatment of uncomplicated malaria in children. We have the local dispersible tablets, and we have the paracetamol dispersible tablets. The artemether-lumefantrine, which is the local dispersible tablets, kills the parasite faster, especially the ring stage in the red blood cells. And the lumefantrine in it prevents recrudescence. The dosing is actually based on weight. So you know that a child that is 5 kg to less than 15 kg takes 1 tablet. 1 tablet is dissolved in water and given to the child twice daily. Then for children who weigh between 15 kilograms to less than 25 kilograms, get to be given 2 tablets. So 2 dispersible tablets dissolved in water and administered to the child twice a day, following the 0, 8 hours, 16 hours, and so forth. But it's dosed twice daily. Therefore, the paracetamol, we all know that the mechanism is multifaceted, and it acts as both an antipyretic and an analgesic. The dose is 10 milligrams per kg. So if a child weighs, say, 5 kilograms, you know that child is supposed to take like 50 milligrams of paracetamol, and this is dosed 4 to 6 hours. So the dispersible AL and paracetamol have not just clinical benefits or operational benefits, but also have benefits to the child and the caregiver. So in the clinical benefits, like I said earlier, it has a faster onset of action because it dissolves really fast, and that means it absorbs fast into body, and this would ensure that the parasite is cleared out and the symptoms are relieved. Then for our business-minded pharmacists, it ensures that it's easy for you to manage your inventory. And for parents, there is no spills, no leak. Even in the pharmacy outlets, there is no breakage and nothing. It's easier to handle and there is no need for refrigeration. Then the caregiver is less confused. Easy administration of these medications to the child. So it's a win-win for all. A win-win for the patients, the caregivers, and pharmacists as well. 25 milligrams of paracetamol. 25 milligrams of paracetamol. It dissolves quickly. The local dispersible is orange flavored, while the Emzor paracetamol dispersible tablet is tutti frutti flavored. They both act fast. The Emzor paracetamol acts fast to relieve pain, fever, and aches, while the local dispersible clears out all the plasmodium parasites and ensures that the child recovers fast and that we do not lose a child every minute. So as pharmacists, this is a practical dispensing checklist. So it's important that you not just dispense Lockmal when someone brings a child or comes to complain of fever, pain, headache, and all of those things, but that you confirm the malaria diagnosis for that child and also ensure that there is fever. Confirm the presence of fever as well. And after you've done that and you are certain that that child has malaria based on carrying out a diagnostic test, then you go ahead to confirm the child's age and weight. Then you give out the medication. You show the caregiver how to correctly dissolve each of the tablets. Then you explain the dose schedule. Is the child supposed to take 1 tablet or 2 tablets depending on the weight, or even 3? Then always encourage caregivers to complete the course. Encourage them not to stop when the child is already feeling better and playing around, but to complete the course of the medications. So what's your role as young pharmacists? We do more than just selling products to them. We should be smart advocates. We should stop Emzor dispersible tablets, stop the Lockmal dispersible tablets, stop the Emzor paracetamol dispersible tablet. Ensure that you match the dose to the child's weight, which is very important in getting the required treatment outcome. Be an advocate for child-friendly treatment so that we can protect our future. Then recommend the combo care, Lockmal dispersible and Emzor paracetamol dispersible, and do well to train caregivers in the easiest language that they can comprehend. Be a smart advocate today. So my challenge to you will be that you recommend to your next 5 malaria cases, pediatric malaria cases, that you recommend this combo to your next 5 under 5 malaria cases. Do I have anyone who is pledging to be a smart advocate today? Can I see your hands? Alright. So our commitment at Emzor is to ensure that we make quality medications available to all our stakeholders at price points that will be of value to both our pharmacists and to our caregivers as well. And we are also committing to getting feedback from you from time to time so that we can improve upon our different activities. So together we can reduce pediatric uncomplicated malaria in Nigeria and even beyond Nigeria. All right.